Good afternoon, everyone. Colleagues, I often think if only the walls of the NLN headquarters could talk. They tell you of intriguing discussions, of fascinating people strategizing to transform nursing education, of initiatives co-created with daring ingenuity. All this and more goes on as the National League for Nursing embarks on our third year in Washington, D.C. Well, the walls cannot talk, so I am taking the opportunity I have each year here at the summit to bring to you the innovations and inventive programming we offer to advance excellence in nursing education. So you may ask, how do we do it? How does the NLN continue to fulfill our mission to promote excellence in nursing education, to build a strong and diverse nursing workforce, to advance the health of the nation and the global community? Even after a challenging move from New York City to DC, what is going on that the NLN continues to thrive? How do we meet the challenge of incorporating the League's 4 core values of caring, integrity, diversity, and excellence into the work we do on behalf of you, of faculty, scholars, schools of nursing, staff, students, and the patients for whom they will someday care? How are we able to fulfill our promise as the voice for nursing education year in and year out? Today, I'm going to tell you not just how, but also why. I'm going to tell you about our secret sauce. I speak often about the 3 Ps that are the building blocks of the NLN Home for Transformative Excellence: purpose, power, and passion. You've all heard these words from me before, either in a speech, in my bi-monthly update, on a podcast, or in an interview. One could say I'm fairly enthusiastic about it. The purpose of the NLN is our mission and core values, as I mentioned earlier. The power engendered by you, that's where we get our power from. 40,000 individuals, 1,200 school members, 122 years of dedication to the profession of nursing and the pursuit of excellence in nursing education. Countless contributions from thousands of volunteers, our members across the nursing education community, 25 NLN state and regional constituent leagues, our local presence, 800 plus National League for Nursing ambassadors at schools of nursing around the country, our presence and our networks in the nation's capital. And finally, the passion. It's the passion that infuses the 7 centers for nursing education. The Center for Academic and Clinical Transitions, led by Dr. Elaine Tagliarini. The Center for Assessment and Evaluation, led by Dr. Janice Brewington. The Center for Diversity and Global Initiatives, led by Dr. Virginia Adams. No relation to the president, I think. The Center for Excellence in the Care of Vulnerable Populations, also led by Dr. Tagliarini. The Center for Innovation in Simulation and Technology, led by Dr. Sue Fanaras. The Center for Transformational Leadership, led by Dr. Janice Brewington, but you can call her Jan. And finally, the Chamberlain College of Nursing, our inaugural partner, the NLN Chamberlain Center for the Advancement of the Science of Nursing Education, led by Dr. Betty Dennis. Speaking about the NLN centers and the outstanding nurse educators who lead them brings me to the subject I fear I have not spent enough time answering the question I posed a few minutes ago. How do we do it? I really have given you the answer already, but let me tell you again. We have a not-so-secret weapon mingled with our secret sauce, the immensely high quality of the NLN professional staff working in collaboration with our fantastic membership and other partners. So where should I begin? Perhaps with a list of adjectives. Committed, inventive, resourceful, productive, steadfast, inspired. Yes, those all fit beautifully. They're all true, but it's not enough. And here I'd like to add the 3 T's to our lexicon: teamwork, trust, and talent. I found a lovely epigraph from Helen Keller that describes the concept beautifully. She said, "Alone we can do so little. Together we can do so much." These few words almost sum up the philosophy that helps the NLN staff with our colleagues achieve success far beyond our numbers. The other 2 T's, trust and talent, are critical ingredients for the NLN team's fruitful collaboration. Teamwork begins by building trust. And talent, of course, stimulates co-creativity and excellence. Of course, without our members, the sauce just isn't ready. So let me back up a bit to the fall of 2013. Having moved to DC in August, the senior management team, here's that word again, the T word, had, under the challenging personal and professional circumstances engendered by the relocation and the reorganization of the NLN, mounted a very successful summit in our new home in the nation's capital. The DC community stretched out their arms to us, and our schools, constituent leagues, ambassadors, fellows, and those daring red bag expert educators, as all put forth their effort to make it an astounding summit. With a short time to catch our breaths, we continued the vital task of assembling a new team. And, spoiler alert, what a great team we've built. Of course, a spoiler alert is not really necessary because the results have been visible ever since. I'm honored to work with them. We used all the tools at our disposal to build and benefit from the staff you see today. The NLN's mission and core values, leadership skills honed by experience, an understanding of roles and boundaries, and input and wisdom from our colleagues. What the NLN has, 2 years later, is a staff that has moved, in concert with membership and partners, to a new level of excellence. A staff that works together incredibly well, a staff that embodies those 3 T's: teamwork, trust, and talent. And here I'd like to concentrate on the importance of trust in the equation. All the talent in the world can come to naught if trust is missing among colleagues. Let's start with the dictionary definition, since I hardly ever go to there these days. A firm belief in the reliability, truth, ability, or strength of someone or something. Team members don't need to be best friends or socialize out of the office, but they do need to trust. This trust involves respect, the wonderful Aretha Franklin kind, and successful outcomes are hard to come by without it. Here's a great example of successful teamwork from this past year. As you know, the NLN launched a brand new website this year that took teamwork that crossed the entire organization, from membership to programming to accreditation to testing to events and everything in between. After all, the new NLN website had to represent the new NLN, the A to Z of the NLN, home for transformative excellence, and so needed input from many constituencies, both inside and out. Here again, no spoiler alert is needed. The NLN website launched in March to great acclaim, and it couldn't have happened without all three of the League's T's: teamwork, trust, and talent. We know that our website is the front door to the NLN, and we want a welcome mat so that our members, colleagues, and friends know how to touch all the resources available. Of course, that's true in extended groups as well. The NLN's collaborative work in the larger healthcare and education arenas are also built on trust. Lend me your ears, colleagues, as I mention just a few good examples from this past year. My first illustration of the importance of the three T's is perhaps the most sensitive. I feel sure our members and the entire nursing, education, and healthcare community were all happy and relieved to receive a joint letter from the NLN and ASIN in August that began with these words: "We are pleased to let you know that working together to meet our shared goal of maintaining excellence in nursing education, the Accreditation Commission for Education in Nursing and the National League for Nursing have reached agreement on our bylaws. Those bylaws are now with the Department of Education and are undergoing their review." How did we get to this positive place? By now you know the answer. Would you please say it with me? Teamwork, trust, and talent. At tomorrow morning's faculty meeting, you'll hear more about this from President Adams and me. An extended Q&A period will give you ample opportunity for comments and questions. Unfortunately, because of prior commitments, ASIN Chair Dr. Mary Lou Rusin and its Chief Officer, Dr. Marcy Stahl, could not join us. However, NLN Commission for Nursing Education Accreditation Executive Director, Dr. Judith Halstead, will be available to answer any questions about where we are with the development of our new accreditation division. CNEA is the NLN's response to the need for an alternative accreditation service in the nursing education community that supports the League's core values and emphasizes a culture of continuing quality improvement in our nursing programs. Here are a few more examples of the three T's in action. Using the NLN's expertise, Laerdal Medical and Wolters Kluwer collaborated with us to develop VSIM, a resource that allows nursing students to experience realistic patient encounters that are essential to their success in clinical practice. Throughout this process, expert simulation educators shared their wisdom and practice in developing scenarios for VSIMs. Colleagues, this is more of the secret sauce. Just a few weeks ago, VSIM expanded to include 52 additional curriculum-driven patient scenarios to be used with fundamentals, pharmacology, gerontology, maternity, and pediatric curricula. I'm impressed. In June, then, the NLN published the latest in our vision series, Debriefing Across the Curriculum. The difference in this vision statement was that it was created in collaboration with another organization, INACSO, the International Nursing Association for Clinical Simulation and Learning. You have to sing it. Without trust, how could we have been able to headline our news release with the words, NLN and INACSO publish vision? Another one, in October last year, the Tri-Council for Nursing, the NLN, along with the American Association of Colleges of Nursing, the American Nurses Association, and the American Organization of Nurse Executives, issued Engaging the Nursing Education Community in the Local Response to the Ebola Virus, a statement that encompasses the community, nursing education, practice, and research. Another example, in December, the NLN joined lead organizations in nursing, nursing education, and clinical ethics who came together to explore the ethical dimensions facing the profession. Without teamwork, trust, and talent, we now would be without a thorough and timely document, a blueprint for 21st century nursing ethics, report of the National Nursing Summit. All of this brings me right back to Helen Keller's words that together we can do so much. This sentiment is reiterated by a posting I came across on the allnurse.com website. I'd like to close by sharing some of this young nurse's words with you. We got to pay more attention to the young colleagues, especially those of us who are of the legacy generation. Her name is Jacqueline Dam, a cardiac progressive care step-down RN from Fredericksburg, Virginia. She had this to say: whether your position serves a clinic, hospital, long-term care facility, rehab center, and more, I am sure that we can all agree on one thing: the lack of teamwork or the bold presence of it can make or break a busy day. Let me add, well, she said it so well, you know I have to add my comments to it. Let me add that this doesn't just apply to clinical nurses, but to those of us in the academic world. Faculty working together with staff and with students across the boundaries of discipline, profession, roles, and positions can make any day not just a busy one. It is the greatest gift we can give to our students and one another to model the intra and interprofessional behavior we teach. We can clearly acknowledge that our students are part of the team. Did you know? A wealth of talented future nurses infused with our trust for the ongoing good of the nation and the global community. Can't you hear it? The NLN transforming through purpose, power, and passion to a level of excellence built with teamwork, trust, and talent. Colleagues, I know we are moving in the right direction, at the right time, with the right message. The right people are making a powerful secret sauce. Whether you whisper or shout it, teamwork, trust, and talent. Teamwork, trust, and talent. Teamwork, trust, and talent. This is the story of the NLN for another 100 years. Thank you.